Good afternoon, Assembly members. My name is Emily Hirio. I'm the chair of the California Hepatitis Alliance, which is a group of approximately 100 organizations around the state that are working to eliminate hepatitis B and hepatitis C. The California Hepatitis Alliance is requesting $8.6 million for the State Office of AIDS to provide rapid hepatitis C tests, improve the delivery of viral hepatitis and HIV prevention materials through syringe exchange programs, and support demonstration projects to improve linkage to and retention and care for people living with hepatitis C. Most of the 750,000 people in California with hepatitis C do not know their status, and of those that do know their status, only half are receiving the necessary follow-up medical care. Most people with hep C are baby boomers, but most new infections are caused by sharing of syringes, particularly among young people who inject drugs. And syringe sharing is the leading cause of new hepatitis C infections and the second most common cause of HIV infections. Syringe exchange programs, along with drug treatment, hep C testing, and linkage to and retention and care are the cornerstones of an effective strategy for eliminating the virus. And there are deep disparities with hepatitis C. Low-income people, African Americans, Latinos, and Native American communities suffer disproportionate high rates of the virus. The unchecked spread of the virus really threatens the health and economic status and welfare of our state and causes, among other things, cirrhosis and liver cancer and death. And it's the leading indication for liver transplants, both in the United States and in California. So we're hoping that the state can have a commitment to both the prevention and the treatment of the virus. This could stop the spread of the virus, save tax resources, and prevent needless suffering for California families. And we also want to note that we support the proposals around STD and HIV services. This kind of combined would be a start towards a comprehensive approach toward some infectious disease prevention that we would all greatly benefit from. Thank you.
Hello, my name is Sam Gonzalez. I'm a HIV and Hep C program coordinator at St. John's Well Child and Family Center in South LA. Just wanted to give a little perspective. At our community clinics, we had about 65,000 patients last year, and only about 5,000 were able to receive a Hep C test. And of those, only 50 have been able to come into our clinic. If we had a prevention program, one of our patients would have been able to prevent the spread of the disease to his son, who shared his toothbrush. And now both of them are going to have to fight with their insurance to get treatment, which is going to be more costly than if we had a prevention program that they could have gone to. So we are definitely in support of the CalHEP proposed budget. Thank you.
Good afternoon. My name is Bronze Courtney. I'm a program manager for the HIV Education and Prevention Project of Alameda County. I know it's a long acronym, but we call it HEPPAC. And we are a nonprofit CBO in Oakland, the third largest syringe exchange in California. And we do linkage retention services, HIV testing. And we were actually awarded a directly funded demonstration project a year ago for hepatitis C. So I'm here to support the CalHEP budget request for HCV testing, because we actually do it at all three of our syringe exchange sites in Oakland and at our syringe exchange sites in Contra Costa County. I'm also supporting the harm reduction supplies, because at this clearinghouse we'll be able to access supplies, hygiene, wound care kits, syringes, all the things that are inclusive at the syringe exchange. And then definitely the demonstration project, because through our previous demonstration projects we've seen the issues with retaining folks into care. And syringe exchange is not just a place where they exchange needles, but where they congregate. A lot of IDUs, regular community who are not injection drug users, people who are baby boomers, come and they can get their status for hepatitis C and linkage and retention services. So I definitely support the CalHEP budget request. Thank you.
Tam Ma with the Health Access California. We're here today in support of the proposals put forth by the California Hepatitis Alliance as well as the California HIV Alliance. As the old adage goes, an ounce of prevention is worth a pound of cure, but we think in this case these very small investments in prevention are actually worth a ton of cure. Thank you.
Hello, Mr. Chair and members. My name is Kat DeBerg with the Health Officers Association of California. I stand today with my STD prevention colleagues to support the STD prevention proposal. And I also want to call your attention to the Lab Aspire proposal that the staff did an excellent job of analyzing. It's a $1 million for 4-year investment to shore up our local public health labs. Local health officials see coming down the line a disaster of epic proportions as lab directors retire. And since we submitted our gap analysis to the committee, we've received word that 2 more lab directors are going to retire, and there's nobody there to take over their place. So now is the time to act, to invest in training more local public health laboratory directors before there's a backlog of samples that need to be tested, before there is an outbreak that needs our attention. We need to train those directors now, so I urge you to look at that proposal. Thank you.
Good afternoon. My name is Stella Armstrong. I'm with the Bonnie Morgan Foundation for HCV. I myself was a patient of hepatitis C. I was diagnosed in 1999 and was finally treated last year. I did the new treatment for Sovaldi and ribavirin, but I'm sorry. I had hep C for over 30 years, and with the new treatment, I was treated and cured. By June 2015, I expect to be cleared for a year. Anybody can catch hepatitis C. It can be transferred through toothbrushes, razors, clippers. It's not just with needles. It's also done through blood transfusions from back in the day when they used to do them. But there are other ways, and I want to share the awareness and the prevention part of it. That's mainly why I'm here. I come down and I volunteer my time to get the word out. Get the word out for testing. I'm everywhere they can have free testing. So it's not very often we get a lot of places like that in San Diego County, which is where I'm from. So I'm here from San Diego trying to represent and get people on the link, and also I support the funding for CalHap. Okay, thank you.
Good afternoon. My name is Paul Souza, and I'm the current advocacy chair for the Sacramento Area Stop Hepatitis Task Force, which is my volunteer commitment. I also am employed with Core Medical Clinic, which is just 5 blocks down the street right here on Capitol. I'm the public health specialist with a focus on hepatitis C and HIV. We are a medication-assisted treatment facility that serves former and current people who inject drugs with a focus on treating addiction. As a representative of both agencies, we wholeheartedly support CalHEP's budget request. In terms of prevention, knowing one's status and linkage to care, there is no better investment the state can make that can save money in relationship to end-stage medical cost, as well as cashing in on the redemptive value of the state's people. Occasionally, our organizations obtain test kits from federal, state, and county public health agencies, and then we are able to offer a critical service that arms the patient with knowledge of their status. During these testing sessions, I'm able to inquire about what strategies are practiced to reduce risks of infection. It is by no coincidence that those who come up negative are using local syringe exchanges. In fact, these contacts with exchanges may be the only place these folks are getting messages about risk reduction, behavior change, and their overall health. In 2008, the Sacramento County Primary Care Clinic for the Medically Indigent used to treat people for hepatitis C. I was fortunate to be a part of that power clinic and have been restored to health. I am cured. Now I get the opportunity to work with people who are in the same boat I used to be. I get to share my experience, what I do to give back to the community, and to educate our clients on how to go about seeking care. With this in mind, I urge you to grant our request. We are the people in the trenches and in the front lines. Arm us with ammunition we need to prevent new infections. Empower the people to know their status so that they themselves can prevent infections and change behavior that speeds up liver damage. Finally, help us to link these folks to care so they can clean up the medical wreckage of their past. This is a viral battle that is winnable, and we are the foot soldiers with the will to fight this epidemic. Please fund our efforts. Thank you.
Hi, my name is Teresa Hughes, and I serve on the San Francisco Hepatitis C Task Force, and I founded 2 nonprofit organizations directly to deal with hepatitis C. We deal with pretty much what people will classify some of the undesirables. We deal with people from corrections, those communities in which they go back to, people who aren't reporting from them. We deal with Native Americans, who a lot of people don't deal with, and we also deal with the whole epidemic of illegal and prescription drugs and how it's been impacted a number of women. I'll only speak about corrections today. Corrections across this country, correctional health care is one of the biggest operations that we have. It's actually larger than Kaiser. So, and for African Americans, Hispanics, and people who are poor, it is the primary health care system that they have. And when you look at hepatitis C, the epidemic of hepatitis C is in corrections. And CDCR, we do nothing but numbers, so if I speak in numbers, it's because that's what I do. CDCR has reported a minimum of 17% of its inmates that has hep C. We know that number is larger because those are the only ones who have been tested. When you have an inmate that is cycling through the system, they go in and out of the corrections and they go uninsured, untested, undiagnosed, they go back into the community, they don't know their status, they come back out, they spread the disease here, they go back. So when you're looking at the economics and the budgets for the state around hepatitis C, you're paying full costs for an inmate. Think about the number of people that you have on second and third strike. It's like, what, 30+% of inmates? Average age is 41. They're going to be costing you an arm and a leg. They go back out. They're infecting people out, so the state is paying on both sides. If you look at Native Americans, look at women under the age of 45, 37 times women. Native American women are dying 30 times greater percent than white or African American women. We're doing a study now in Tennessee. We're lucky to be able to do studies all around. And we're looking at the impact of illegal prescriptions. In Tennessee alone, in less than 4 years, hep C increased by 117%. If you start looking at the rural communities that we have and the number of people using illegal drugs, we're looking at the same thing. Communities we are dealing with is what we like to call the sleeping giant. And that, sorry to say, but we're waking up. And when we start waking up, the cost impact of that communities that we're dealing with is going to be devastating to the state.
Thank you.
We have any support you give. Thank you.
Thank you.
Good afternoon. Glenn Backus for Drug Policy Alliance in support of the request from the HIV Alliance and CalHep. I'll be very brief, speak to a recent event that most of you are aware of, an outbreak of HIV and hepatitis C in rural Indiana, the southernmost part of the state bordering Kentucky. I hold it up as an example of the failure of prevention. California already suffers from historic lack of investment in prevention services. That's why we have high rates of hepatitis C that we're paying a great deal of money to treat in Medi-Cal, in corrections, and for private insurers, and more importantly, for California families. What just happened in rural Indiana, in a town of 4,000 and some folks, normally has 5 new HIV cases a year, they identified 100 this year, related to injection drug use of Opana. Opana is a prescription medication intended to treat pain. It was being used non-medically to get high, and now they had an outbreak of 100 cases of HIV, and according to sources at CDC, more than 80% of those cases also have hepatitis C. That's for lack of needle exchange. That's for lack of drug treatment. That's for lack of linkage. That's for lack of treatment and testing for hepatitis. Those same conditions exist in most parts of California, in the Inland Empire, in Imperial County, in eastern San Diego County. So in summary, throughout our state, we have the same conditions. If we don't invest in prevention, we're asking for the same problems. Thank you.
Thank you.
Chair and members, Kathy Mossberg here on behalf of my colleagues at Planned Parenthood Affiliates of California who cannot be here today, who have asked me to voice their support for the STD proposal. Thank you.
I thank you, and I thank Member Bonta for assuming the chairmanship of the committee, and Member Chu. I understand that the committee's already taken action on this, and I'll be adding on my vote for this. Do we have any other items? Seeing none, we'll leave the roll open. Members are off in various committees. We'll leave the roll open for members to be able to add on, but the formal part of our meeting is adjourned. Thank you all very much.